Hi everyone, welcome back to another episode of Psych Talk. Today we're talking about substance-induced disorders, which are basically mental health disorders that arise because of the use of a certain substance such as heroin, alcohol, marijuana, etc. And so we'll break down the different types of substance-induced disorders, how they affect mental health, and what happens during intoxication and withdrawal. And so, substance induced mental disorders are mental health conditions triggered by substance use in individuals who previously did not have such issues. So, for example, let's say you never had anxiety or depression in your life, but since you started drinking alcohol or smoking marijuana, you started developing certain symptoms of both anxiety and depression. And so, because of that, we know that obviously the anxiety and the depression is most likely being caused by the substance that you're using rather than by other things. Same thing with psychotic symptoms. For example, let's say you have never had hallucinations in your entire life, but you started saying things that weren't really there once you start using cocaine. And so, what are some of the most common types? We have substance-induced psychotic disorder. So this involves hallucinations, delusions, or both, occurring within a month of using or withdrawing from a substance. And then we have substance-induced bipolar disorder. This disorder includes manic, hypomanic, or depressive symptoms that develop while using or withdrawing from substances. And mania and hypomania are states of extremely high energy, mood, and activity levels. Mania is more intense, so people may feel unstoppable, talk really fast, need little sleep, take big risks as well, like spending too much money or driving recklessly. And they may sometimes lose touch with reality. So an example would be a person that does not sleep at all throughout the night because they're so excited about the new idea that they got about, starting a new business. And he's not the person that tries to fall asleep at night, but they're maybe too energetic and they can't fall asleep, but they desperately want to fall asleep. People with mania, they actually are just so much full of energy that they just want to do things, that they talk very fast and they have all these crazy ideas. They might spend all of their paycheck at once in an hour or something like that, something very impulsive. And then we have hypomania, which is a milder version. The person has extra energy, feels super confident, and is more active, but they can still function in daily life without major problems. And so again, this is substance-induced bipolar disorder. So some people develop bipolar disorder because of genetics or because something that happened in their life triggered the expression of the gene, etc. But again, certain type of drugs can induce certain mental disorders. Okay, and then we have substance-induced depressive disorder, which is a form of depression that occurs after substance use, but not directly tied to intoxication or withdrawal. Then we have substance-induced anxiety disorder, so anxiety or panic attacks triggered by substance use, which must be distinguishable from general withdrawal or intoxication effects. Then we have substance-induced obsessive-compulsive disorder, which is characterized by new obsessive and compulsive behaviors due to substance use, which significantly affects the individual on a daily basis. Then we have substance-induced sleep disorders, so insomnia or other sleep disturbances caused by drugs, alcohol, or medications. Then we have substance-induced sexual dysfunction, so difficulties with arousal, performance, or desire as a result of substance use. And then we have substance-induced delirium. So how does delirium look like? It's cognitive confusion, trouble thinking clearly, and a person might seem disoriented, forgetful, or have trouble paying attention. They may say things that don't make sense, see or hear things that are in there, or act very restless or sleepy. And it comes on, quickly and can change throughout the day. So this is basically what delirium is. And then we have substance-induced neurocognitive disorder. So mild to severe cognitive impairments that persist beyond withdrawal, particularly from prolonged stimulant use like methamphetamine or cocaine. And so while all substances carry the risk for all of these mental disorders, there are some that may be more responsible for example, substance-induced bipolar disorder or substance-induced depressive disorder, etc. For example, marijuana intoxication, so it can alter perception, it can, provide relaxation or paranoia, and so it will make sense that people who abuse marijuana, and not all people who smoke marijuana or do drugs develop like a substance-induced mental disorder, obviously, but some do. And so maybe there is a small percentage of people who do smoke marijuana that may have substance-induced psychotic disorder. And for example, cocaine intoxication and cocaine addiction can make you feel with an increased energy, euphoria, or agitation, which will make more sense for the individual to develop substance-induced bipolar disorder if they abuse cocaine. Whereas for methamphetamine, when people are on methamphetamine, they have this extreme alertness, hyperactivity, or aggression, which also can cause people to develop substance-induced bipolar disorder or other disorders as well. Heroin, while individuals are on heroin, they feel more sedated, their breathing is slower, and they can also experience euphoria. Whereas people, when they're abusing hallucinogen like LSD, acids, etc., they have disordered reality, hallucinations, and mood swings, so it will make more sense for them to develop a substance-induced psychotic disorder, and so on and so forth. And so again, people who are using certain drugs, they can develop substance-induced mental health disorders. And one thing that you will see though is that once they do stop using the drug, certain mental disorders can go away, whereas some can stay if they use the drugs for a very long period of time and the damages are too great to fix. And so yes, for some they can repair, they can get better, they might not experience those symptoms of those mental health disorders, but some, they might have the mental health disorder or cognitive impairments forever, depending on how much they abuse the drug. And so understanding these disorders can help us recognize the impact of substance use and the importance of safe withdrawal strategies. And this is the end of the episode. Thank you for listening, and don't forget to follow us on Instagram or called Psych Talk Pod. Thank you.